Dose of medicine will be on an anesthesia topic, which is barbiturates. In barbiturates, we'll be mainly focusing on thiopentone sodium, which is the prototype barbiturate. Before diving into thiopentone sodium, let us know a little bit about what barbiturates are and its classifications and a little bit of its properties. Based on the duration of action. Based on the duration of action, they can be classified into ultra short acting, and long acting. Now, under ultra short acting, we have thiopentone sodium, which is the prototype barbiturate. Prototype barbiturate essentially means that you use this drug's properties and you consider this as the main representative of the group, and you compare it with other groups, with other drugs of the same group. And the second ultra short acting is methotrexate. Coming to the short acting, we have secobarbital and we have pentobarbital. And in long acting, we have primidone and phenobarbital. Coming to some of the uses of these short-acting barbiturates are it is used in status epilepticus. It is used for narcoanalysis, and one of the uses of phenobarbital is it is used as an anticonvulsant in children and in pregnancies. Now let us look at some of the general properties of this group, these barbiturates. These are mainly analgesic agents, so which means that these agents are painful injectable general anesthetic agents. Next property is that they have a narrow therapeutic index, which means any type of overdose can lead to death. So it is not used for insomnia. Some of the symptoms of overdose can be flabby muscle, altered level of consciousness, shallow respiration, and bullous eruption on the skin. So how do we treat such overdoses? How do we react? What treatment do we give in such conditions? Let's talk about that. So there is no specific antidote for an overdose of barbiturate as such. There is no such antidote. We treat the patient symptomatically. We give him symptomatic treatment, which involves dialysis, and forced alkaline diuresis, through which we try to remove the drug through diuresis by alkylating the urine. And now let's look at some of the very important characteristics of these barbiturates. These barbiturates are powerful microsomal enzyme inducers. Inducers imply that they increase the activity of the microsomes, increase the activity of microsomal enzymes, which in turn decreases the level of other drugs. That it increases the metabolism of the other drugs and thus decreases its levels in the blood. It also has the property of autoinduction, which means it can induce its own metabolism and reduce its level in the blood. It also induces the enzyme ALA synthetase, and therefore it is contraindicated in intermittent porphyria. Now, coming to the topic proper, let us talk about thiopentone sodium now. Thiopentone sodium is an ultra short acting barbiturate. It is a prototype barbiturate. Now, coming to the preparation and its physical properties. Thiopentone sodium is and always should be reconstituted to a concentration of 2.5% with normal saline or with sterile water, but never with Ringer's lactate. Why? Ringer's lactate reacts with alkaline substances and precipitates it. The pH of thiopentone sodium is highly alkaline, which is 10.6. Thus, Ringer's lactate along with thiopentone sodium will be precipitated and should be always avoided. Thiopentone sodium is a yellow amorphous powder. It is a yellow amorphous powder. Most of the yellow colored substances, gives you a hint that it contains sulfur. It also has sodium carbonate and is in nitrogen atmosphere. Now coming to its mode of action. The site of action is on GABA A receptor and the action is agonism. Now let us have a brief look at the GABA A receptor. These are the membranes. This is the receptor. Now, in the first, there is alpha and beta subunit. It is made up of alpha and beta subunit, and the second is made up of alpha and gamma subunit. So now, Thiopentone acts on alpha and beta subunit of GABA A receptor, which is a ligand-gated receptor. Now, at low doses, barbiturates binds with alpha-beta unit of GABA A and is GABA facilitatory. That is, it increases the duration of opening of chloride channel. Now, at higher doses, it has a GABA mimetic action. That is, it mimics the actions of GABA. It acts as GABA itself. This also leads to increased duration of opening of chloride channel. So, if the chloride channel is opened, the cell becomes hyperpolarized, which leads to an inhibitory neurotransmission, which in turn leads to CNS depression. Increased duration of opening of chloride channel leads to hyperpolarization. And inhibitory neurotransmitter action leading to CNS depression. Coming to the pharmacokinetics, that is what this drug is a highly lipid soluble drug which has a ultra fast onset of action. It takes approximately 1 arm brain circulation time, that is 15 to 20 minutes, to have its action, and it is also an ultra short acting drug because of its redistribution in the body. It is also metabolized by it is metabolized mainly by the liver. Coming to the pharmacodynamics, let us see what the drug does to the body. We will approach this system-wise. Firstly, the cardiovascular system. Thiopentone sodium has a direct myocardial depressive effect which leads to a decrease in blood pressure. This in turn leads to an increase in heart rate, which is called reflex tachycardia. To summarize, it causes tachycardia and hypotension.